Mr. Olson, you're 66.
Yes, sir.
Looking good.
Thank you.
You're feeling good, too, aren't you?
Yes, I am.
You got the legacy of some kind of surgery there on your scalp. I'm going to show them you under the knife here.
All right.
Boy, you must have... I mean, that didn't bother you? Just they laid you down and went right in there.
Well, I just sort of gritted my teeth and said I'm going to do it.
William Olson, you suffer from Parkinson's.
That's right.
So you got the shake. You did. Let me show them the surgery here. Show them this, Brian. Here's William Olson in surgery. Now, what are they doing here? William Kohler, MD, PhD, professor and chairman of the Department of Neurology at the University of Kansas Medical Center. I'm going to ask you to help us out here. What are we implanting here?
What we're doing for Mr. Olson, we're putting a small electrode in a very small part of his brain that deals with Parkinson's disease.
Now, they're asking him to do this. He's purposely shaking, but this was actually, this is the pretty good evidence of the nature of his shake, isn't it? Look at that left hand going.
Yeah, we can see his symptoms in the operating room, and he's awake because we need him to tell us when the symptoms are getting better on the operating table.
Yeah. Look at this.
Good morning, Phil. Today is the day after surgery.
Yeah, it's the first day of the rest of my life.
Want to try and get out of bed for me?
See the tremor?
Okay, now stimulator is
Off.
off, okay.
Meds were taken about 10 minutes ago.
This is classic presentation of Parkinson's here. 1 day post-op. We still have the tremor. There it is. It's not going to happen overnight.
Now stimulators are both on.
Now they're activating the
Yes,
stimulators in the brain.
Stimulators on.
Holy cow, what's next?
Oh, like that now. Okay. Here we go. Arm in arm.
All right. Give me a little demo here. Let me have the wood. Just out in front of you, Mr. Olson. Right in front of you. Just put them out in front of you. Give us a little demo here. You are some kind of show-off. You know that? Have a seat. All right, I'm looking here. When was the surgery? Because the skin-to-skin here looks pretty recent.
Yes, it was, the most recent one was March 14th.
No, on the top, on the pate here. There you go.
March 14th.
So that's about a month ago. A little less, 3 weeks ago.
Stitches are all out already.
Yeah. Now, how do you activate this thing? Does it go buzz in your brain? Can you feel it?
No, but I have magnet that I activate it with, if you want to see that.
Yeah, I do. And where, so you have, is it a battery, look at this. Metatronic is the name. All right. No, let's see. We still got. There's no miracles here. You still occasionally, if you get in the right spot, you got the tremor back, don't you?
Oh yeah.
There it is, right there. That's involuntary, isn't it?
Yes, it is.
But you can control that by moving your hand, can't you? Just move your hand to another place, down at your side.
Yeah, that does help.
Now, you couldn't do that before this, or could you?
Not as readily.
Not as readily.
No.
So there is a visible difference in your tremor, in your involuntary neurofirings here,
I think so.
after you take this. And you can't, where is the unit? Where do you place it?
We've got one right here and one right here.
So this is both sides of the brain then.
Right.
And the wires go up here, and what happens here, Wizard?
They go from the pacemaker to the wire to the electrodes in the brain, and it's constantly firing and actually blocks that part of the brain.
Blocks it.
That's
So
right.
the firing, the artificial electronic energy you're introducing into the brain does what?
Well, it has the same effect as destroying part of the brain, but we don't have to destroy it. We could block it with continuous electrical activity.
Have a seat, Mr. Olson. What is it that you block? What are you blocking?
Well, what we think we're blocking is excessive firing in the brain that's responsible for some of the symptoms of Parkinson's disease. So by introducing high-frequency stimulation, we block that part of the brain and make it more normal.
You make the brain think it's normal.
More or less. We haven't cured the Parkinson's disease, obviously, but we've involved the circuitry to somehow fix it so the patient can be more normal.
When a Parkinson's patient has something going wrong with the neurotransmitters in the brain, am I correct so far?
That's correct. In Parkinson's disease, the chemical dopamine is basically depleted.
So that normally, in non-Parkinson patients, normally dopamine, which is that biochemical feature of the brain which allows us to feel mad, sad, or glad, is it not?
Well, it really has to do with more movement.
Movement, not feelings?
Not really. It's really the ability to move your arm, to be precise with your movements.
And after the dopamine is introduced into the brain activity then in a person who's not a patient, it then restores or returns to its cellular place where it resides?
Well, the chemical is being replenished and repleted, and it's a dynamic system, that's true. But in Parkinson's disease, that system doesn't work so well.
Susie Harris joins us. You have Parkinson's, Miss Harris.
Yes.
Your symptoms are different.
Yes, I have rigidity and loss of coordination. I don't have a tremor.
Right. Here you are, steady as a
Yeah.
neurosurgeon yourself.
Well, I've had a great procedure.
Right. But you don't jump out of a cake, do you, anymore?
I can.
Can you? You can? Yeah? May I ask you can I ask you to stand just for a second? That was once very difficult for you to do, wasn't it?
Yeah, it took about half an hour.
You had to concentrate.
With Parkinson's disease, there's a delay between knowing you want to move and actually moving. And it's a battle.
Here's a videotape of you putting your coat on.
Oh, okay.
Boy, you're gonna be late for everything.
I can do it now.
You can do it now. This is pre-op. Incidentally, we have a different. This is. Tell them before we show. What was the nature of your surgery, Ms. Harris?
I had what's called fetal implant or transplant surgery.
So then, from the material that has been transplanted in your brain comes from aborted fetuses.
Correct.
The surgery that was given to you was made possible by President Clinton lifting the ban on fetal research.
Actually, no, that made it okay for the government to fund the research.
Oh, I see.
This was done by a private program.
So we didn't have the political
Right.
pro-life influence on the private research program.
Exactly.
And it takes
The
a good...
reason, if I could jump in.
Please.
The reason is this is not the be-all, end-all for Parkinson's because there are a couple million patients and it takes about 4 donors for each one to have my surgery.
Four donors, meaning 4 different fetuses.
It's not likely we're going to get 8 million donations of tissue. So this is an interim procedure, biologically being researched to not need so much fetal material in the future.
So actually you see yourself then as a step on the way.
A guinea pig ass.
You're the Wright brothers. You're a test pilot.
I'm a test pilot.
You're out there in the wild blue yonder.
Hopefully the biogenetic form of this surgery will be available shortly, but first we have to see if it works at all.
When you say biogenetic form, you mean synthetically?
If we can take one donor and make enough cells in the laboratory to cure 1,000 people, that's kind of the goal.
I see. And that would be a synthetic
And
replacement for what you...
It's just some research bucks away.
All right. Well, just so for the record, so we understand here, you are a beneficiary of these early trials of fetal transplant into your very own brain.
Yeah.
Okay.
Four new sets of DNA. I mean, I might wake up in the morning and play the violin for all I know.
You never know. I'll tell you what. You know, or if you keep saying we'll be back in a moment, that's going to scare me. Here we go. Here you are, Suzanne. I should say, I hope you don't mind, you're 47, and so you're a young Parkinsonian, aren't you?
About 10% of Parkinson's patients are young onset.
Under 50.
Correct.
Here you are trying to put your coat on. Watch this now. This is before surgery.
First, I have to concentrate on getting it into my hands. Then I have to somehow get it onto my back, which
which usually requires me jumping, like this. One more time. But I have to think about jumping. 1, 2, 3, go! Okay, now I have to get my right arm in. I'll just do it the way I always do it without talking. Now I'm frozen and I can't move at all. I have to start again somehow by changing the movement a little bit. Now I'm exhausted and frozen.
You have to think about it before you do it. How frustrating this must be.
Well, that's because prior to surgery, my left hand was totally paralyzed, and now on no anti-symptomatic medications, it's back to normal.
Parkinson's can cause paralysis?
Oh, yeah. It's the neurotransmitter dopamine enables you to move your body. And when you have a deficiency, you can't move.
You sit next to Abraham Lieberman, MD. You're a neurologist, sir, and you are identified, acknowledged to be one of the top Parkinson doctors in the United States. You recommended surgery to Miss Harris. Do I understand that?
That's correct.
You didn't do the work. You know about the work and you recommended it
I
for
work at the hospital in Los Angeles that does it, Good Samaritan Hospital.
You're clinical director of the National Parkinson Foundation, chief of the Movement Disorder section of the Barrow Neurological Institute in Phoenix. Let's just show Susie afterward. You were not able to get up, or at least it was very, very difficult. She had to think about it, you know, plan it, focus.
And even then, it didn't work usually.
And sometimes, you know, the old motors didn't respond, did they? Here you are. This is just to give you a sense of how paralyzing this is. Here you are afterward. Before, this was much more difficult.
Well, this is rather soon afterward.
Yes.
Takes a long time to.
Yes, it does. But watch the improvement here. You really pick up here. Incidentally, nice posture. Look at this. Look at this. This is a tremendous leap forward for this young woman who has been randomly hit by the neurological disorder known as Parkinson's. But we have wizardry underway. We're talking now not only about fetal transplant, but also about technology implanted in the brain which can improve the Parkinson tremor. Incidentally, Janet Reno has Parkinson's, our Attorney General. Her hand visibly moved in her press conferences, and the press did make an inquiry, and she said, yes, I have it. There's also film indicating that Adolf Hitler had this. We have a number of highly visible people who are struck with this, and now they're presenting themselves in public with it, and more attention is coming to this, as it should, because wonderful things are happening in research right now, improving the lives considerably. We're going to talk with the doctor and with more patients when we come back in just a moment. All right, Dr. Lieberman, you're the chief movement disorders section, Barrow Neurological Institute, Phoenix, and you are clinical director of the National Parkinson Foundation. Are we over 1 million here suffering?
About 1 million.
1 million people.
Yes.
Onset usually after 50.
That's where most people get it.
And we also know that it's about the biochemistry of the brain.
Yeah, I think I should make a point. You've really shown two paradoxical things: no movement and too much movement tremor.
Right.
And what
difficulty of movement and involuntary tremor.
Right.
Yes.
So you've really shown sort of a dichotomy where there's no movement and excessive movement. And this reflects some of the complexities of Parkinson's disease. Dopamine in some ways, when you don't have it, it acts as a brake, and it slows you down. And if you don't have it, it also turns on other parts of the brain that speed you up. So it's as though the brain is really a series of checks and balances. And you lose dopamine, which is a brake, so you slow down. But when you remove the brake, you also activate some other motors, which is why, paradoxically, you speed up. So that's why there's sort of a paradox.
But this research is grand. I mean, what we're doing here.
It's inconceivable 5 years ago.
Yeah. Where in her brain is this fetal tissue implanted?
There's a part of the brain that is called the striatum. And it's called the striatum because it's striped. The Latin people named it so it's striped. And it's above the main area, which is affected by Parkinson, which is the substantia nigra, which means black substance. Nigra is Negro black substance. There's a part of the substantia nigra that is called the putamen, or the nut. That's what it means.
Oh, my eyes are glazing over, Doc.
Well,
go ahead. Go ahead. I appreciate your, I can't criticize you for wanting to try and tell us the truth. Is it in the center of the brain, at the base of the brain?
It's at the base of the brain. It's at the base of the brain and to the side, to the right and left side.
So where would her incision be then?
The incision is done stereotactically, like we did with Bill over here. So you make an excision on the outside of the skull, and then you thread a needle deep into the brain under stereotactic guidance. And when you get to the area that you're interested in...
You're using a TV monitor, I assume, for this?
Yes, and you deposit the cells into that area.
And voila.
It takes about a year. Susie's been getting better in time because the cells actually have to grow and integrate themselves into the circuitry of the brain.
I see.
With Bill's operation, it was an immediate thing.
So he's got the technology, she's got the fetal tissue.
That's correct.
Two different remedies.
That's correct.
Two different symptoms.
That's correct.
Which could she benefit from his electronic device?
If she had a tremor, yes, she would.
But the most important point to remember is no one's ever gotten, this is a degenerative, incurable disease that no one's ever gotten well from.
That's right.
I am determined to get well, and this surgery can make that happen.
We can see it. You are getting well. Well, anybody with a name like Bill Smith can't be all bad. Okay, you're the brave guy, steps forward here. Here we are, classic Parkinson's tremor. Help us out, docs. Nothing mysterious about this.
Tremor only.
You don't have a tremor only. Look at this, how steady you are, right hand. Now hold up your left hand.
Actually, we'll put his hands in the position that we normally test. This is called the rest position. And the classic tremor of Parkinson is in the rest position.
I didn't realize we had the condition would only express itself in one hand. Isn't that unusual?
Well, he has it in both hands, and but we performed a procedure on the left side of the brain for the right side of the body.
So, in other words, he's got the implant left on the left side of his brain, right?
Right. The controls the opposite side of the body.
So, calming the right side.
That's correct.
So why don't we give him something over here to calm this side?
I think we'll do it eventually.
Is that the plan, really?
Correct.
That's okay with you, Mr. Smith?
Better believe it.
Yeah? So you notice the difference right away. Hold that right hand up there. Look at that. Look at that.
We'll hold both of them up, too.
And the steadiness here is because we've got an implant here.
That's correct. He has a pacemaker put here that stimulates this part of the brain that controls this half of the body.
You notice this lump on the side of my head, that's where the wires go down from the brain down into the...
Well, I can't see the lump on the side of your head, Bill. You know, your family would be glad to know.
Sure, you can't even see where my hair is.
Oh, I do see it. Yes, yes. All right. Yeah, there is.
That's where they connect the wires.
And your program is going to be a right side implant as well to handle this.
Right.
So we have electricity correcting a biochemical problem in the brain.
Well, what we're really doing is kind of fooling the circuitry. We haven't solved the problem, but we fool the circuitry so that it works and the tremor's gone.
Okay. But he has to activate the electricity from the instrument implanted in his brain, doesn't
All
he?
he has to do is turn it on and off with a magnet.
Like
Turn it on in the morning and off at night.
Oh, so it's on continuously all day.
That's correct.
So you don't just zap yourself when you need it then?
No, as long as it's on, his tremor's controlled. If he turns it off, the tremor returns. So we just keep it on during the day and turn it off at night.
How old were you at the onset of this, Mr. Smith?
About 50 even.
What, 50?
52.
And you were what, working one day and looked down and there it was, going to town or what?
It came on gradually. I used to be a musician, played the guitar, ran a country band for years, and I began to notice my hand shaking as I tried to fret the instrument. From there, everything went to hell.
And you were, well, you say 50, you're now 62. You've had 12 years of wilderness here and not a hell of a lot of help, isn't that fair to say?
Absolutely.
All of a sudden, here you are with a battery in your head, for God's sake.
I'm unable to take any of the medication, so we're sure all of my control comes from the stimulator itself.
This is a totally technological fix we've got here on the right side.
I can eat again now.
Yeah, that's a fact.
You ought to try doing that.
That is great news. And we'll be back in just a moment. Muhammad Ali has Parkinson's. And you are his doctor, is that right, Dr. Lieberman?
Yes.
Was his condition exacerbated by all those punches in his head?
Well, I think that's what led to his condition.
So that you see violence then as a provocateur of this disease?
Well, among professional prize fighters, not random violence, but Muhammad Ali, first of all, Parkinson's is relatively uncommon among black people. And if you look at this audience, there are very few black people. So there's less among black people. And for Muhammad Ali to have gotten it at an early age...
you want to make we haven't told our viewers that a significant number of people in our audience are Parkinson's afflicted.
That's...
so that was your point. Okay.
That was the point.
Go ahead.
But he developed it at an early age. You wouldn't have expected him to have developed it. And I think it was brought on, by the fighting, by the boxing. There was injuries to a part of his brain that produces dopamine, and I think that's what set off the Parkinson's disease.
Here's Janet Reno. Watch this. This is our Attorney General.
The FBI
Just take a
has
moment.
gone to great
Watch
pains
the
to
left
ensure
hand.
that there is no armed conflict.
Well, you can see.
No
See, she's
shooting,
holding
no
onto her
armed
hand there.
perimeter, and no use of military assault tactics or equipment.
You can see the
FBI
tremor.
is trying to negotiate
And she's
peaceful
managing
solution.
that. A little later in that conference, she released it, and you could see the tremor. Here's another 20th century political figure, no less a personage than the Fuhrer himself. Now, not a few neurologists. What do you think here? What is this?
Not moving his left hand.
He's not moving his left hand. So that's all you need to know. What?
No, you have to have a tremor, and in a later film, there's a portion that clearly shows that he has a tremor. A decreased movement of the left hand, he could have injured his left hand, he could have been hurting that day in his left hand. What I did is I tracked about 10 years of tapes to demonstrate he's not moving his left hand, and then the final tape that showed the tremor. And that's when we knew that he had Parkinson's disease.
Mm-hmm. Back to Mr. Smith. We've already established the right side fine, left side. Here's I'm not sure, here's a videotape of you prior to surgery. Here you are, both hands firing. See the right hand, which is now still?
The right hand is worse than the left.
And that's why you had the implant on your left side of your brain first. Right.
Right.
Look at that. Boy, that's got to make you mad, especially a guitar guy.
Absolutely.
I mean, this took away one of the very important features of your life.
Love of my life.
You don't want to say that in front of your wife, but hang on just a second. Love you, love my guitar. Is that what you want to know, Mom? All right, hang on just a second. Okay, I'm going to ask you to do one more thing for us, Mr. Olson, and I thank you for, Mr. Smith, pardon me. I thank you for allowing us to, just hold your hands out there one more time like that. Just put your, all right, don't forget, right side brain, the juice is on, influencing a steadiness in the right hand. We have no remedy yet for the left side, but you plan to have surgery on the right side of your brain to correct that.
Just as soon as they'll do it.
Right. Now you pick up your little handheld thing there. All right, now you're going to turn it off. You can turn off the power in the instrument in your brain.
Right.
All right. Hold your right hand out. Now turn it off. You just turned it off. Now turn it on again.
Didn't get it.
And we'll be back in just a moment.
Phil and Jesse Jackson remember their history-making shows.
We must never stop reaching out.
Don't miss the next Donahue.
Susie Harris, the former reporter, you had that computer terminal in front of you all the time?
That was when I got my first symptom. I was attempting to work at my computer, and my left hand just didn't respond.
You have worked for some major metropolitan newspapers, so you're quite obviously a talented person who's brought your own skills to your professional work. And you suddenly had to face the reality. I assume you got to a place where you could no longer type.
Definitely. And the hard part about it is when this disease hits you, it's like a dead end. It's how you feel your life is just got...
You're sane, you're lucid, you know exactly what's going on.
You can't move.
And you feel like you've hit a wall and there's no apparent evidence that you're going to get around it or over it.
Yes, my family sent me to psychotherapy at the time, and my doctor said, if you want to get well, you get out there and engineer your own recovery somehow.
Patient, heal thyself.
So I became the president of our local support group and really got involved with the movement, which made a big difference for me.
I want to, Ms. Harris, I want to show our audience your tape of, here you are trying to stand up, just standing up. How old are these tapes? How long ago was this?
1 year. I believe if it's, are they the clinical tapes?
We'll show them. Yeah, they're the, here we go.
That's 1 year ago. 1 year and 2 months.
And how long ago was your surgery?
1 year and 2 months. This was the night before.
Oh, this is the night before your surgery.
My left foot over to the left.
She's concentrating now on getting up.
Push myself off with my hands. This is also the way I usually get out of the car, is to crawl onto the pavement and then push myself up in this manner, and I usually have to straighten my own hand out because it's always sort of like a claw, so that I can push up and stand up.
Oh, am I going to...
Come on, you can do it, girl. There you go.
Okay, want to stop it?
One night before surgery. One night before surgery. Do you mind?
I'll give it a try.
Okay, take your time. There's no hurry. You're going to sit down first? On the floor, right?
I can get myself up.
Okay, fine. I won't get in the way.
Now, this sitting down may be a little...
Now, let's understand. Her surgery was 1 year ago. We've already had a physician tell us that this is not about the next morning. The improvement is not instant. Look at this. Okay.
Has anyone ever had the surgery where they've rejected the fetal tissue?
Well, the thing is, we don't know if people reject the tissue, because once the tissue is in the brain, we really have no way of checking for rejection. People have died several years after they've had the operation, and we can see that the cells are actually growing into the brain. We think rejection would probably be that you don't have an effect. There are ways that we had one patient, when we did a pilot program of this, we had one patient, all the patients we put on anti-suppressive therapy to block the immune response. And there was one patient whose husband didn't use the money to buy the medicine, he used the money to drink, and she was the only patient who got a transplant of that first group and didn't improve because she didn't get the medicine because he didn't.
Now, let me just repeat here. Dr. Lieberman, sir, you are clinical director of the National Parkinson's Foundation.
That's correct.
So if anybody is to be respected, it would be you, and we would say the same of Dr. Kohler. So we feel very comfortable having you here. You're not going to tell us what you don't know. You're not going to tell us something you're not going to overstate your very conservative presentation here. I got to tell you this. I got to believe there are people out there drilling holes in heads in this very area who don't know what the hell they're doing.
I would agree with you.
So how then does someone ensure that their loved one, and it's usually the kids or a spouse, and it's usually someone over 50, you're going to take your medicine?
I did already.
Oh, you already took your medicine?
Yeah.
Okay, God, the last thing I need
Snuck up a little early on it.
Yeah, I didn't take my medicine because Donahue wouldn't let me. I mean, whoa. So buyer beware here, huh? As in all things, including medicine.
Well, you can do a number of things. The National Parkinson's Foundation has 45 centers throughout the United States that it funds locally. So there are 3 centers in New York. You can call the National Parkinson's Foundation in Miami, and they will give you the telephone names and numbers of people in your area that are affiliated with the National Parkinson's Foundation.
Here's the national address, 1501 Northwest 9th Avenue, Miami, Florida. The zip is 33136.
It's the Bob Hope Foundation.
The Bob Hope Foundation.
So he does not have Parkinson's disease.
I'm sorry?
He does not have Parkinson's disease.
We can assume, who else had Parkinson's disease that we know?
Mao Zedong.
Mao has it.
Had it. Francisco Franco. Deng Xiaoping, who's the current ruler of China.
Parkinson's seems to be attracted to dictators, doesn't it?
Well, Morris Udall.
Graham.
Billy Graham and Morris Udall.
Billy Graham and Morris Udall. No dictators there. And we'll be back to talk to you.
Paul.
John Pope, the Pope has it?
Well, we don't know.
You're not sure, the doctor says.
It's not being released.
And we'll be back. No, the Vatican is not famous for handing out. And we'll be back in just a moment.
Your name is...
Yes.
I would like to say I have the highest respect for you 3 in terms of fighting Parkinson's disease.
Yeah.
Was there anyone in your family that had this disease?
Good question. Is it hereditary? Is there a feature to this? Doctor.
Parkinson's disease really doesn't pass from one family to another, although in some family trees we see more cases than we suspect. So we think there might be some genetic predisposition, but that hasn't been discovered as yet.
Yes,
my
ma'am?
mother died of Parkinson's disease about 6 months before my surgery.
Who did?
My mother.
Really? Uh-huh. Did she develop her tremor before you did?
Oh, yeah, about 15 years before I did.
I think seeing the wonderful research that's gone on here leads us to believe that we have hope for a cure within 5 years. We have a bill, the Mo-Udall bill, before Congress that we're hoping to get passed by the Congress this year that will provide specific funds for the NIH to use it in developing more research programs.
Why is the tremor only seen in your hands?
Why is the tremor only in the hands? I'm not sure that's...
It can be in the foot. It can also be in the chin. The hand, there's more of a predisposition to the hand, but it can be in the foot, and it can also be in the chin.
Sir.
2 questions. One, okay, you mentioned Muhammad Ali. He also has problems with speaking. Is that related to the Parkinson's?
Yeah, Parkinson's, the muscles of speech are muscles, and they can be tightened and shut down.
Yes, Miss Harris, did you notice that?
I'm
speaking.
sorry.
Was speaking a challenge?
Only that my voice got very weak and quiet. It's not weak and quiet now, but...
My other question was in regards to side effects, especially on the ones with the wiring. The patients who are using the...
It's in the right side of my mouth, these 2 fingers and my thumb.
Yeah, when the device
just feel numb.
Right. When the device is turned on, some of the patients feel tingliness, but often that just lasts for a short period of time.
Thank you.
I don't have any of that at all.
Yes.
tremors do not necessarily indicate Parkinson's. What other symptoms can be displayed to make the diagnosis, and what tests can be used to make the diagnosis?
Yeah, that's an interesting question because a lot of Parkinson goes undiagnosed. In fact, one study said 40% of all Parkinson in the United States is not diagnosed. And it usually starts on one side of the body. Slowness, stiffness, difficulty walking can all be early Parkinson signs.
This can happen to you if you drink too much.
But you could have tremors from a variety of disorders, and essential tremor is another condition. Katharine Hepburn has essential tremor and not Parkinson. So you're right, many conditions can cause
She
tremor.
doesn't have Parkinson.
No, she has a condition we call essential tremor.
What is the difference?
Well, essential tremor, the voice shakes, the hand shakes, and in essential tremor, the hand shakes during movement. In Parkinson, the hand shakes during rest, and so that's one big difference.
But presumably we have similar origins of these displays, do we not?
No, they probably occur in different areas of the brain.
Why is it uncommon for African Americans to have the disease?
Don't know. For one, we're not certain if many patients of African Americans have the disease and they may not know it or may not be going, for medical care. So that's one possibility. But the second is there may be something that predisposes them not to have the disease. The answer is I don't know, but we just don't know. But right now, there's much fewer African Americans with Parkinson's disease than others.
Yes.
Does this have something to do with your job? Because she was, she used to type all the time, and he used to play the guitar.
No.
Good question, though. It does sound like we have a guitar player and a woman who sat at a terminal most of her professional life.
But that could be that they're more apt to notice the symptoms, early on. But you also have people who develop it at very early ages. You have people who have sedentary, occupations. As far as we know, repetitive movement does not predispose to the development of tremor or Parkinson's disease.
Does the amount of medication that you take decrease after the operation?
Well, there are two different operations. Susie is off all medication. In patients who've had fetal transplants, eventually the amount of medication goes down and it's decreased by half, and in some people up to almost 100%.
Yes.
I was wondering if the operation costs a lot, and does healthcare cover it?
With fetal transplantation, right now it is not covered. The first 6 operations through a pilot program were funded, but the operation now is not covered, and the costs run about $40,000 to $50,000.
Right.
And it's not funded because it's an experimental procedure.
Right. We have a considerably powerful, and we'd have to say large, lobby protesting and working to end fetal research. As our audience knows, the misgiving on the part of the Catholic Church and other religious institutions is the concern that we could literally be moved to abort a child for the purpose of harvesting material to correct, for example, the condition like Ms. Harris. You probably have no enthusiasm for even getting into this argument. Would you want to say anything about
Yeah, I think, first of all, there are very strict safeguards for this, so that a woman has the abortion because she wants to have the abortion. She knows nothing about the donation of tissue. She is asked about donation of tissue after she has had the abortion. So there are no inducements. There's no monetary pay for this, but she is asked after she's actually aborted the fetus, and then she's presented with, would she give permission to use it?
Why do you need 4 different fetuses to harvest enough material to implant so that it's effective?
Because there's a rapid loss of cells. You're putting in, there's about 300,000 cells in the brain. When you get Parkinson's disease, you've lost about 60% of those cells, or 80% of the cells. So, but when you take 300,000 cells from one fetus, about 90% of those cells, from the time they leave the uterus to the time they're implanted, have died. So you're actually not implanting.
So it's a diminishing resource then.
That's correct.
Even after it's been harvested.
That's right. And
so you have minimum time frame for implantation.
Within 2 days, it has to be done, or the tissue's not good.
Does it matter which part of the anatomical structure the material comes from?
Yes, we take a certain portion of the lower brain.
Lower brain.
This is I'm sorry, go ahead.
Please.
This is an important area because
Certainly is to you.
Nobody likes the idea that this tissue needs to be used, and the idea is to get past it, research-wise.
Yes, this is
But
the interim
first-
step toward
right.
the development of a material, either synthetically or whatever other way, that does not harvest material from fetus.
First, we have to know if it can work, then how it works, and then duplicate it in a less offensive way to the principle of
Right.
fetal.
In the future, we'll have cells we can buy in the store and put in the brain.
I bet we will. We can make skin now, right? We got skin, which essentially is a vehicle or an interim host for the promotion of the restoration of your own skin. Whoa, man, I'll tell you what. And just last week on this program, a woman who has somebody else's bone right there in her leg. Another person's bone.
Incredible.
Holy cow, I'm going to come back as another person here if we have a... Can you put it on your MasterCard? We'll be back in just a moment.
For a transcript of Donahue, send $3 to Journal Graphics, 1535 Grant Street, Denver, Colorado, 80203, or call 303-831-9000. To order a video cassette for only $24.95, just call 1-800-FOR-VIDEO.
All right, Duke University. They have found the gene in a mouse that if they take it out, the mouse is always high. It's like the mouse has a constant dose of cocaine in his head. What do we care? This could profoundly influence the future of research on Parkinson's. Here's a mouse. They found the gene. Take it out, and you're constant high. There is no dope in this mouse. No dope. All they did was take away a gene. Watch this. Look at this. That mouse is in the same biochemical brain condition as a person on cocaine. So what? Tell them, Doc.
Well, first of all, it's not as simple. You don't just pluck out the gene. The gene is a piece of information that codes the making of a protein and a structure in the brain. So to figure out how to, one, find the gene, and then delete it so that the mice are born without the gene is a tremendous technological breakthrough. It's almost like splitting the atom. Then you now have a mouse who does not have the gene that regulates dopamine. So it's as though you have too much dopamine, which is the excess, which is the reverse of Parkinson's.
So when you take cocaine, it isn't the cocaine that makes you high. It's what the cocaine does to the dopamine, which is already in your brain, that makes you high.
That's correct.
So the dopamine stays there, giving you the bzzz, whatever it is, the high. You don't want to go to bed. We've stories people up 4 or 5 days in a row. You can be mimicked by removing this gene.
That's correct.
So we could be here at the fundamental base of Geno on the matter of addiction.
Yes, and many other diseases too.
So alcohol does that to our brain. It influences the biochemistry of our brain.
I'm not quite sure where alcohol works. With cocaine, we're a little more certain as to what the problem is. It's excessive dopamine, and so we have a clue. Alcohol, we're not quite as certain.
But if you could correct the cravings of addiction to cocaine, as far as I'm concerned, that's 2 Nobel Prizes. I mean, think of it. All you got to do is you go in for some kind of procedure, and you're never going to want that junk again.
I know some people think it's Aldous Huxley. You know, it's.
But this is not Orwellian now, is it? I mean,
no, we're really at the scientific frontiers.
And we'll be back in just a moment.
Phil and Jesse Jackson remember their history-making shows.
We must never stop reaching out.
Don't miss the next Donahue.
The National Parkinson Foundation, once again, is at 1501 Northwest 9th Avenue in Miami. The zip there is 33136. Guess who I found here in our audience? Let me just turn you around because I wanted to see your hand. You got to do their hand behind me, Brian. And she's 41 years old. I know that because she told me. So I found a young one here, Doc. But you've seen 41-year-old Parkinson people before. You had no surgery.
No.
Uh-huh. And you've got more than a passing interest in what's happening here, aren't you?
Oh, yes. I have questions for everybody.
All right. I saw your notes. You'll have all the time you need to ask your own questions right after our program. You wanted to say briefly, I'm sorry I don't have more time.
Dr. Lieberman, could you speak to the psychiatric and neuropsychiatric aspects of this disease?
Well, it does affect cognition, and it does affect thinking, and it does affect mood.
I regret our time is up. Join me in thanking all these folks for a very important
Services provided and promotional fees paid by the following.